Hi, my name is Beverly Nakawatase, and today I'm going to be telling you about the coronary artery bypass graft procedure. This procedure is a surgery performed to create a path for blood to go around a blocked artery in the heart. It would most likely be recommended to someone if there is a blockage in the left main heart artery. Intense narrowing, which just means that there is less room for blood to flow through the artery, or chest pain as a result of this narrowing. If more than one artery is deemed a diseased heart artery, or if there is a blocked heart artery that can't be treated with a coronary angioplasty or a stent. A coronary angioplasty is a procedure done to open clogged arteries in the heart, and then a stent is going to be a device that is placed in the body to keep that structure open. So if these two do not work, then it would be recommended to have a coronary artery bypass graft. So the first step in this procedure is going to be the patient preparation. The patient will be admitted into the hospital and then will undergo a standard test to make sure they are stable enough to go through this procedure successfully. Before the patient enters the operating room, they will be administered a sedative through an IV or an intravenous line. Once the patient enters the operating room, they will be administered anesthesia for life support, which just puts them to sleep and makes sure they are unconscious for this procedure, which is super important. This surgery is considered more serious, so other forms of life support might be admitted, such as intubation and ventilation, intravenous lines, urinary catheters, and absolutely heart and lung bypass machine, which is formerly known as a cardiopulmonary bypass machine. Then your cardiothoracic surgeon will make an incision in the chest with a scalpel, which is just a thin knife used for surgery, splitting the breastbone down the middle with a sternotomy saw, and will open the rib cage to expose the heart with a rib spreader. These are all just common tools used during this procedure. Your heart will then be stopped by the cardiopulmonary bypass machine will be turned on. This machine just basically mimics the functions of the heart by pumping blood and adding oxygen to the body while the heart is stopped. The cardiothoracic surgeon will take a harvested blood vessel and create a bypass. The upper end attaches to the aorta, and the lower end is going to be attached to the blocked artery past the blockage. That way blood can just bypass that blockage and then keep on flowing. The patient's heart will then be restarted. The sternum is brought back together by sternal approximation. The rib cage is then placed in the appropriate position and closed using sternal wire closure. And then finally, the incision is closed with staples and sutures. The medications administered for a coronary artery bypass graft are going to be the anesthetics, which put the patient to sleep, anticoagulants, and antiplatelets, which are all medications that help prevent blood clotting. So there are risks and complications to any procedure. Risks pertaining to coronary artery bypass grafts include arrhythmias, which are irregular heartbeats. This could include atrial fibrillation, which can lead to an increased risk of stroke, bleeding, infections, myocardial infarction, which is a heart attack, and kidney problems. Complications can be intraoperative or postoperative. Intraoperative complications can include hemorrhaging or hematoma formation, kinking or twisting of the pedicle, arrhythmias, and GEA spasms. So the pedicle is a narrow stalk of tissue containing blood vessels that supply blood to an organ or tissue. And when this kinks or twists, it can inhibit that blood from flowing to those important organs. And then arrhythmias, irregular heartbeats, and GEA spasms are going to be a spasm of the gastroepipaulic artery. Post-operative complications can include perioperative myocardial infarctions, which is a heart attack that occurs during or shortly after the surgery. Graft occlusion, which is a blockage or narrowing of the graft, which reduces or stops blood flow. Low cardiac output. Cardiac output is just how much blood your heart pumps within that minute, and so low cardiac output would be a low amount of blood being pumped during that 1 minute. Vasodilatory shock, which is when blood vessels are too relaxed, reducing blood pressure flow to vital organs. This is actually an emergency, life-threatening, like medical emergency. And then also pericardial effusion, which is a condition in which extra fluid collects between the heart and the pericardium. And I'm sorry, it's like thunderstorming really badly at my house. And then pericardial tamponade, which is a serious condition that occurs when extra fluid or blood builds up in the space between the heart and the pericardium. Late recurrent angina pectoris, that is recurrent chest pain, with, again, also every procedure comes aftercare, which ensures your recovery. It may take several weeks for a patient to fully recover, and during this time, patients should avoid doing strenuous activities that could elevate stress on their heart. It is important to take medications exactly as instructed by your provider, and it is also important to go to your cardiac rehab. This is rehab instructed and medically monitored by trained medical professionals, and can be really beneficial to someone who might be experiencing post-op complications and might not know it. These trained medical professionals might be able to catch it and possibly save a life. For even better recovery results, patients should work towards a heart-healthy lifestyle. This could include quitting smoking, eating healthy, daily exercise, managing stress and weight, as well as getting good sleep. And also, to ensure a good recovery, you must go to your post-op appointments. These follow-up appointments will be scheduled by the patient's provider, and it will be super important to go to these to ensure that there are no complications, and if they are, fix them before they become severe. During these appointments, providers will check heart functions and remove any stitches, staples, and check for infection. So, why did I choose a coronary artery bypass graft procedure? Well, before I was born, my grandpa actually suffered a heart attack, and he needed to have bypass surgery. And when I was growing up, he would take me and my little sister to the pool and the beach, and I would see this scar on his chest and always like ask him what it was, and he tried his best to explain it to me, and I tried my best to understand. But now that I've done this project, I know exactly what happened during his procedure. And what's nice about this is that after this happened, he made sure to really try and better his health and better the health of his family around him by always having, heart healthy foods, fruits and vegetables for me and my little sister to snack on, and anyone else who wanted to snack on those as well. This procedure is incredibly significant to healthcare. Before this procedure, there was no help for people suffering from heart attacks or coronary artery disease before, where blood was blocked, not being able to flow productively. Before this procedure, those with coronary artery disease basically knew that they might have a premature death. Past treatments used were medications that caused vasodilation, which is just dilation of the blood vessels, but that can only do so much. Now, surgical intervention can be used in conjunction with lifestyle modification and medical management. Again, it offers a lifeline to those with coronary artery disease or those who had who suffered a heart attack, giving them the ability to survive the basically once inevitable death that came with coronary artery disease, as morbid as that sounds. So I have a bunch of medical terminology that I use during this presentation, including what a surgery was, and what an artery was, a stent, the heart chambers, anesthesia, intubation, ventilation, intravenous lines, urinary catheters, all of the things that are additional life support that are given during this procedure. And this section has some medical tools that are used, like a scalpel, sternotomy saw, a rib spreader. It has some also some main body parts that are used during, like, that are, you know, important in this procedure, like the aorta, which is the largest artery in the body, the breastbone, which is also known as the sternum, in the chest. And then we have some medications and their definitions, and some complications and their definitions on this side. And then we also have, again, complications, risk factors, arrhythmias, irregular heartbeat, strokes, infections, angina pectoris. And then I got most of my information from the Mayo Foundation for Medical Education and Research, which was really helpful. They helped a lot with the definitions. Search results, NCL search results, which also helped with definitions. The coronary artery bypass surgery purpose, procedure, and recovery that I got from the Cleveland Clinic. And then coronary artery bypass grafting using the gastroepipelic artery. That had a lot of good information on it as well. All of it gave me risks, complications that could happen, the procedures, the tools, the important components of this surgery, the body parts, the breastbone, aorta, blood vessels. Helped me understand all of that. So I really hope that you enjoyed this presentation and enjoyed learning about the procedure of a coronary artery bypass graft. Thank you so much.